the relationship between the different professionalism, and also affect the patient care, and ultimately lead to better patient safety. I have no disclosure. So I can see there are four attendees in here. So because the number is not that big, so I would love to know what is your specialty, and why you are interested in taking this webinar. So we can speak a common language during my presentation. I appreciate if you can type what's your specialty in here, and what are you looking for from this webinar. We'll give you a minute. Okay, I will proceed. So maybe during my presentation, if you would like to introduce yourself and just mention your specialty, it will be great. So when we speak up about the communications issue, and how can make it better in order to improve the patient safety, it will be easier for us to speak a common language if you are nursing, or if you are a physician, or you are working in the admin, or you are in quality departments or other specialties. So the objectives of my presentation is to define what is the communications, what are the goals of communications and common ways of communications, and communication process, what are the barriers, if there is any technique and method to enhance quality of interprofessional communication. We'll start talking about introduction and facts, and if we have a good team, we can introduce ourselves again, and maybe come up with the team building activities. Then we'll touch the interprofessional communication barriers, tools, and outcome. We'll take 5 minutes break in between, and then we will use our tool to communicate. I attach a video. Unfortunately, I'm not able to share it with you. Then in this case, we just gonna to open a discussion if you have any question, and then we'll wrap it up. So I will start by this slide. Like this is very common problem in healthcare systems. The communication issue, despite everybody knows it's really important, but we are not really communicating efficiently and effectively between the healthcare provider themselves, and between the healthcare providers and patients. This communication matters. Yes, communication is matter a lot. It's more than just talking between you and the other healthcare providers, and you and the patient themselves. It's a loop. So are you sure if you are saying words, that's words coming from your mouth and going to the other person, is understandable very well? It is the same thing. So we have to be clear when we communicate with other person, and be sure that that person understand what we meant by our words. So could, because ultimately lead to affect the patient safety and also the patient experience if the understandable it's not the same things. And the same thing here between the interprofessional, like this is a very common issue happen in the operating room, where the surgeon maybe he says something and the anesthesiologist as well the technician and the nursing understand something completely different, and the patient at the end maybe will get the wrong treatment. So communication is really a matter, and the problem if it's not being understand very well between you and other healthcare providers specialties. So again, what is a communication? The definition of the communication, it is the art of transmitting information, ideas, and attitude from one person to another. It's a process of interaction among a human being. It's two-way process. It's not one way. It's a two-way process of searching, of reaching mutual understanding. This is very important, so that we be understood by this another person, in which the participant encode decode information. Have to be sure that when I give you info, so you understand my words, you understand it as I want you to understand it, not based on your interpretation. So again, why communication is important? There is a lot of evidence indicate that there are strong positive relationship between healthcare team members' communication skill and patients' capacity to follow through the medical recommendations, self-manage a chronic medical condition, and adapt to preventive health behaviors. So if you are working in a hospital and you see your patient is persisting not taking his medication very well, you have to be clarified if he understand the importance of taking that medication. Maybe he understand, but he doesn't understand how to use it very well. Does he understand your word? Does he know how to utilize it? Are you sure that he understand it very well? Did you see him how to use it? So it's really very important, especially in our community. We have different different society, different level of educations, and so your words maybe not well understandable to your patients. And the same way also, when you say words to a nurse or to physiotherapy or to the pharmacist, maybe me as a surgeon, I use certain terminologies is not understandable. So I have to be sure this is clear, because it affects the patient outcome. So, and the other fact, the clinician ability to explain, listen, and emphasize can have a profound effect on biological and functional health outcomes, like patient satisfaction and experience of care. So that is important. Patient satisfaction increases when members of the healthcare team takes a problem seriously and explain information clearly and try to understand the patient experience and provide viable option. There are a lot of research being done in the last 10 years, between 1995 to 2005, and demonstrated that ineffective team communication is the root cause for nearly 66% of all medical error. It's really big numbers. So if the communication is not clear, lead to more than 60% of the errors. Healthcare quality survey conducted by the Commonwealth found that 25% of the American reported that they don't follow their clinician advice, and provide the reason for that is around 40% disagree with what the clinician wanted to do. So you have to explain the treatment very well to the patient, and you have to be sure that the patient is really understand and he believe in what you are talking about. More than 27% were concerned about the cost. This is not supposed to be in our country. 25% found the instruction too difficult to follow. This is really very important. So we have to go down to the earth when we speak to the patients. I'm not sure if all of you speak Arabic. It's one of the problem in the country that we have healthcare provider coming from different places, and they have different language, Arabic and non-Arabic, and also the access of even Arabic speaker is different, making the patient to understand the instruction for taking the medication and how is the disease is really very difficult, especially elderly people. So I try to use the patient's word. I try to use also when you speak to your like your colleague, try to use very simple words, clearly and understandable by him or her. The other fact, which is that found like 7% reported they didn't understand what they were supposed to do. That is really very dangerous. So is after all this fact, is communications important? Yes, it is an important, and it is really matter for the patients. So inadequate communication, as I mentioned earlier, okay, lead to more than 50% of adverse event in the hospitals. One of the problem for inadequate communications is a medication discrepancy, which is the error happened because of the medication of the inadequate communications. 14% of the cases of the hospital discharge have medications errors, okay, because of inadequate communication between healthcare staff. So this lead to the 50% error in the medical system. So this lead to inappropriate in patient care and affect the patient safety ultimately. So what are the goal of the communications? It's the goal in general for any communications is to change a behavior. You communicate with the other person to change his behavior, and also to get an action. So you say something to have an action from other side, to ensure understanding. So when I write an order and when I verbalize it, when I communicate with my colleague in the emergency department, in the OR, in the consultations, I have to be sure that my word is understandable, and also to get and give information. So when we discuss a case of a sick patient with an ICU doctors, or between doctor and nurse, or between pharmacists, what is the better medication for the patients, it's important to be the discussion to be clearly to be understandable, to have clear action plan for the patient. This is really important. What are the most common ways we communicate? That we communicate either through spoken words, written words, or by the visual image or body language. The communication process usually goes through a loop. This is a sender, and this is the medium, and this is a receiver. And then the receiver will get a feedback and send it back to the sender. And there are a lot of barriers in between, which is can affect the communication process. So if you write something, or you verbalize something, or you have some behavior, and you wanted to send this to the receiver, you have to be sure that these barriers is not exist or minimize in order to give appropriate information to the other person. So that is important stage. What are the barriers and what are the tools and what are the outcomes for interprofessional communications? Before I go to the barriers, do you have any question right now? Okay, I will proceed to the next. So, what are the barriers for interprofessional communication or communication in general? Okay, it's the barrier for the interprofessional communication is the same as for any communication process. Um, First, inconsistency in team membership and lack of time is really very important. It's you can see working in the emergency department, busy emergency department, they don't have a good time for communications. So the information being transferred from one nurse to another nurse in non it's not consistent, it's not complete, lead to the missing some of the information. At the same thing also between the physician and the other physician, when they change the shift, everybody rushed to go to finish his shift, to go to leave the emergency department. So lack of time is an issue. We have to design a time between that is suitable and dedicated for the communication between healthcare providers. Lack of information sharing. There is no good communications. So I know something about my patients and I didn't give it completely and clearly to another person who was involved in the management of that patient. So this is an issue. Hierarchy. You know, if the senior person within the team, like the supervisor in the nursing department or the pharmacy, they don't give all the information to their team and being clear about the situation, this is affect the patient safety. So in when it comes to the patient safety and when it comes to clarify the patient information and the person situation, okay, we should focus on the patient outcome more than is the different hierarchy. um, Conventional thinking, the conflict is another issue between the employee in the hospitals. So we shouldn't put the personal conflict between us, between the nursing doctors, pharmacists, and that let this to affect the patient management. And not talking to each other doesn't mean that I'm not gonna to give you the information that is really important in management of the patients. Lack of the rule and clarities, distraction, that is also an issue. Noise, that is another important issue. If you are working in a busy environment, like and very noisy, like working in ICU where a lot of devices around you and a lot of people working and going in and out, when you're working in the emergency department, in the trauma center, working inside the OR, it's when you wanted to communicate and give information to your colleague that's related to the patients, you have to pull yourself away from the noisy area in order to give the information in a transparent and a clear matter. Inappropriate medium, that is also an issue. Assumption and misconception. So when I say something about the patients, um, I suppose to be clearly, and I have to be sure that the second person in front of me understand what I said. If I said this patient taking GTN, okay, so GTN, it's an abbreviation from one of the medications. So is the second person is understand what I said, is understand what is the GTN, what does it stand for. If you are not understanding, you have to say what is GTN. I don't get your, its abbreviation stand for what. So have two persons, when they communicate to each other, have to speak a common language. They have to understand every single words, uh, share and every information about the patient, because this is ultimately lead to the affect the patient's safety. Language difference is really a matter. I find it plays a major role in our society. um, we have people working from different community, from different society, from different countries, even those who speak Arabic, because their accent are different. Our community, they don't understand it, and at the end they don't use the medication very proper. And also within the nursing and doctors and physiotherapy, the pharmacists, sometimes, all of us, we speak in English, but if you are from different area and your accent is different, you might not understand my accent. So if you don't understand, stop me and say, I'm sorry, I didn't get you. Do you mean this and this and this and this? This is very important. Poor listening skill, this is a big issue. I remember, I was working in a hospital. I was just a junior, and there were two nursing working together, and they changed in the shift, and one of them, she was trying to finish her shift and just give information about her patients to her colleague. The second person, she were not listening at all. She was busy looking at her phone and looking at the messages, and the other person just speak up, speak up, speak up, speak up, and said, okay, everything is done, yeah, thank you very much. And I'm sure that the second person, like, she didn't hear her very well. Even she doesn't understand what is the situation completely. After her colleague left, she started to look back at the note, and she said, this colleague spoke about changing in the vital sign, and we give the patient fluid. This is really very dangerous. So we are here dealing with the patients. We are not just taking information from other colleagues just because of taking information and just finishing the job. No, that information is variable, and it affects the patient outcome. So we have to listen very carefully when we take information from other colleagues. So what are the best practice in interprofessional communication? What do you think the best practice in interprofessional communication? If there is any best practice? I can see here Hanan Al-Ghamdi. Hanan, are you working in a hospital? Okay. Um, I wish if we can have a good um, interaction, so the session is not going to be like a very like boring lecture. I wish if we could have more discussion. So if anyone wanted to ask a question or just step forward and having a discussion from like previous slide, please go ahead. So what is the best practice? It is The best practice in the communication is by using routine, reliable, and secure forms of communication. Okay, should be established between the healthcare providers. The clinical practice is always busy, so communication systems should emphasize a technology to facilitate interaction and improve team efficacy. So we could use a technology to have a clear and very good communication between the healthcare providers. Communication should include a patient and caregivers. So we are not communicating only between ourselves as healthcare providers. The communication should include our patients, their relatives, and caregivers at their home. And the conversation should in this matter should avoid any unclarity. To We have to be clear, provide very clear informations, and using very simple words when we involve the patient and their relative. The interprofessional communication should emphasize a good listening skill and mutual respect for all the team members. So there is no we shouldn't look at the seniority or different specialty. I'm superior to you because I'm a doctor, you are a nurse, you are a pharmacist. No, because we are treating a patient in here. So we should all speak common language, and we have to be clear of our rule in general. Team members should feel comfortable providing constructive feedback to one another. So within the team member themselves, between the nursing or between the physician junior and senior, we have to provide a very constructive feedback. So if I feel there's wrong in the management of the patient or something happening wrong within the patient's situation, so I have to pronounce it very clearly, and I have communicate with the with my colleague about the condition in a clear matter. So we shouldn't use unclear language. We shouldn't use unclear way of communication, because that is lead to patient impairment, especially if it comes to the management, if it comes to medications error. Teamwork is very important in order to um, improve our communication process. Then we'll come to speak about the tools that be gonna to be used in the patient communications. Do you have any idea about the common tool that we are using in hospitals for improving the interprofessional communication? Any volunteer from the attendees? If you are working in a hospital, or maybe if you work in any health system, primary, secondary, or tertiary, are you using any tool for communication between within your department, within the colleague, or between your your like other specialities, like physician, nursing, um, pharmacist? Okay. So anybody familiar? Okay, thank you. Anybody familiar with the team steps? So okay, that's really great. So team steps, it's a very efficient way of to ensure a proper communication. It's well known being used in the simulation for educations. So in the team steps, we speak about five steps. A problem oriented approach, defining what constitute a successful outcome as part of the planning process, a commitment from leadership for a plan as a proposed, a plan for communication should be initiated after that. A training for the intervention should involve the staff of all levels of care team. So team step is very important to ensure appropriate communications. Usually we tag the issue, the problem, and we define what is the outcome if we improve that problems, and we plan a method of communications, and based on that we plan a training. Other strategy that we use is bar, call out, check back, and handoff. ISBAR, I think most of the nursing they are using ISBAR, okay, in their communications. If you are using another method different than what I mentioned, please share it with us. So what is ISBAR? ISBAR stands for Situation, Background, Assessment, and Recommendation. Situation, after identifying yourself, present a very brief description of the presenting issues. The background is related to the present issues of the patient. For example, assessment, provide your thought regarding of the issues, and then what do you need as a recommendations. Offer your plan and ask for the input. We'll take an example. This is very good table again for the ISBAR. So situation, background, assessment, and recommendations. So an example for that in the situation, for example, the nurse is calling and said, I'm calling for Mr. X who is having a trouble in breathing. That is a situation right now. So it's describe what actual situation of the patient. The background, what is the background or the context of the patient? For example, this is a 50 years old man patient who having chronic lung disease, diabetes, hypertensive, admitted to the hospitals, and his actual situation right now is get worse. So this is a background. Assessment, it's for the current situation. So I didn't hear any breath sound in his right chest, or maybe his oxygen saturation is dropping down, and I think he has a problem. Recommendations. So what you need, okay, when somebody call me over the phone and tell me this is a situation, that is a background of the patients and my assessment showing that. So what recommendation from that person, what you need from me after all this info? I need you to come here and to see the patient, please. So ISBAR is very important to have to be taken as a tools to transfer informations and communicate between two healthcare providers. So when you have a strategic plan of communications, so missing of any variable information will become less and less. So is it an efficient tool for communicate? Yes, it's a very efficient tool. And there is a lot of studies showing the communication by using ISBAR within the hospital improve the patient care, improve the communication between healthcare providers, and improve the patient safety. Should I move forward to the next slide? Do you have any question? Okay. The next tool is call out. Call out is the strategy that is used to communicate important or critical information. It informs all team members simultaneously during emergency situation that helps team members anticipate next step. So you call out, okay, if there is a problem, you come to the patient happen, you come to the emergency to the patient room, and you found the patient not in a good situation, so you go and call out, okay, like you shout, you ask for help. That is another strategy for communication. Checkback is another method of communication that within the team step. So you have to close a loop of communications. You give an information or you give a message, and then you check other person, do you understand what I mean? So the second person have to repeat your words. So for example, if I say, um, please, can you hook the patient to a vital sign? So the other person who listened to me said, okay, do you want me to hook the patient to vital sign monitoring? So by this way, I'm sure that the second person understand my words. So they understand what is the vital sign hawking. If she doesn't understand or he doesn't understand, he should ask, do you mean this and this and this? So its explanation is very important, and to double check that the second person received the correct information exactly, uh, what I mean to be, not only my words. He understand what I mean to be for the patients by repeating the same words, and be sure that the action gonna to be happen exactly as the first sender being want. This is very important. By this way, we ensure that there's a closed loop of communications. Handoff is a transfer of the information during a transition in the across the continuum. Okay, it includes an opportunity to ask a question, to clarify, and confirm. An example of this, if the patient move from emergency department to the floor, so the emergency department nurse should transfer the patient with information about what is the background, what is the current situation, what is the current plan for the patient, and why he came to the emergency, and why patient transferred to the floor. Similar situation, if the patient transferred from the floor to the higher intensive care unit, so the information between the two services should be clear. The current situations, and what is the background, and why patient transfer, and if there is any plan and recommendation need to be done. um is everything is clear? Do you have any question? Okay, unfortunately the scenario cannot be open, so I will escape this. If we have good communication skill, then we will have a very good outcome. So we gonna to have a shared mental model, we'll have adaptability, we have a good team orientation, and we have mutual trust between the healthcare providers, and we have a good team performance, and that lead to the patient safety. So putting the patient at the center of interprofessional communication can improve many cases, and that will uplift the health care outcomes to ensure a good patient safety by having good good community, good communication skills between the doctors, physician, pharmacists, nursing, different hierarchy of the physician, junior, senior, consultant. It's very important that we speak a common language that lead to proper patient management. Again, this is an MCQ, is based on the previous slide. If you have time, maybe we can answer the MCQ together, because I was planning to ask you to download this applications, and we answer the question that you found in this application, but we're gonna to answer it together. So the first question, which of the following statement is correct regarding interprofessional communication? It will eliminate human errors and reduce adverse drug event. It can optimize team performance and reduce medical errors. It involves discussion among healthcare professionals, not patients and their families. Which one is correct? You can choose more than one answer. Number 1, 2, 3, all of them. The first one only, the second one only. Any volunteer? Okay, thank you. So number 2 is correct, and number 1 also is correct. Number 3 is not correct. So it involved discussion among healthcare professionals, not patients and their families. No. Okay, it involved, okay, it's number 1 is okay, number 2, but also in the interprofessional we involve patient and family sometimes in our communications. Second question, which of the following tools for effective interprofessional communication? Shouting out, BLS, day off, shake back. Which one? Which is correct? Which one is not correct? Number 1, shouting out. Is it a tool for communication? BLS, is it a tool? Day off, is it a tool? Shake back, is it a tool? Number 1, yes, correct. What about BLS? 4, perfect, yes, shake back. Okay, great, you get it. So number 1 and number 4, of course, basic life support is a basic life support. It's not a tool for the communications, and they off for sure not a tool of communication. The last question, the SBAR framework is a tool of healthcare members to communicate to each other. Which of the following statement best describe this communication strategy? We'll read the question. The answers. It provides a brief, structured format for sharing patient information effectively among key staff. Number 2, team member rapidly review patient chart and identify missing information during a handoff. It informs all team members simultaneously of critical information during an emergency. Members of healthcare team role play to better understand each other perspectively. What do you think? All the answers are correct. Only number 1, only number 2, 3, 4. Okay, perfect. All the answers are correct. So we come to the wrap up and reflection too. So go back. 2 is correct. Actually, all the answers are correct. It provides a brief structure format for sharing patient information effectively among key staff. Yes. Team member rapidly review patient chart and identify missing information. Yes. It informs all team members simultaneously of critical information during emergency. Yeah. Members of healthcare team role play to better understand each other's perspective. All of this are correct. So since okay, yeah. So we'll go to wrap up and reflection. Do you have any question before I proceed to wrap up and reflection? Uh, it's we are finishing soon. So, or you wanted to take a break? It's up to you. Do you have any question? Okay. So, in communication, what the thing that we need to do in order to have a better communication? We have to think ahead about what we are gonna to say. So before we verbalize any word, we have to be clear what's going, what is it really gonna to be affect the patient care. It doesn't matter when I say the words or not. We should use very simple words and phrases. We shouldn't be complicated. um, we have to increase our knowledge in all subjects that are required to speak. So when I speak about something, I have to be understand what I'm talking about. So it's not logic if I talk about some medication and I don't have any background about that medications. So when I give you the information, and the information that I will give it to you, it should be understandable for me, and I have to be really very informed. Okay, so I by this way I can give you the correct informations, because this is lead to the patient safety. We have to speak clearly and audibly. So we shouldn't speak in a noisy medium. We shouldn't speak in any clear area. I should speak very clear language. My words should be understandable very well. We have to check twice if the listener understand my word or not, like as I'm doing right now with you. If you understand what I'm saying, okay, you confirm it to me that yes, it's understandable. Is my voice clear? Yes, your voice is clear. This is very important, okay, within the working environment. It's not only within the hospitals, even working in as a team. So you give something for your colleague, and maybe she doesn't listen to you very well. If this not happen very well, the mistake it happens and could continue as a loop. You take the information incorrect, and then you do something wrong, and what you did, you give it to another person, and this may be into a major problem. Maybe it started from very simple word that you didn't get it, or maybe you hear the word but you didn't understand it the way that she wants to give it to you. At the end, a major mistake could happen. So imagine this if related to the patients, patient safety and patient management. It's really a disaster. And if the second person doesn't understand, so we shouldn't feel shy that to ask, do you mean this? I understand this. If this is correct, or maybe I understand it this way. This is what you mean? Okay, because the field of understanding the first person lead to the gap in understand, and lead to medical error, lead to the patient management problems. So we have really to understand each others. Don't. So we shouldn't instantly react and matter something in anger, because that is a matter for the patients. And this even in the regular in the regular work, even in the admin, even it's not only within the healthcare system. Don't use a terminology not understand by the majority of people. Don't use abbreviation. Don't speak too fast or too slow, okay, because maybe the other person cannot pick up what you are talking about. Don't speak in audible surrounding, like in very busy environment. If there's an important information you wanted to give it to another person that is really critical and related to the patient safety, you have to choose a good place, so where that person can hear you very well. Don't assume that everybody understand you, so you have to double check. Is my word clear? Do you understand what I mean? Okay, is everything is clear? Double check is important. Improve your body language is really very important. So we have to keep a proper distance between us and between other colleague, between us and between the patients. Touch only when appropriate. Take care of the appearance, because this is a very good reflection to others. And maintain eye to eye contact, and always smile. Okay, the smiling is a cheap. It doesn't cost you anything, and it solve a lot of reflection between the workers. What is the take-home message? The majority of the perceiving ability come from how you communicate. So we have more than 17 muscles in our face to help us to smile. Well, to frown, you need to use 43 muscles. So smile every time you see someone. You're not gonna to use a lot of your muscle. The strongest muscle in your body is your tongue. It should be used very effectively. No matter how knowledgeable as a healthcare providers might be, if he or she is not able to open a good communications with others, it may not be so helpful, and this lead to um, uh, patient safety impairment. Those are my references in case if you wanna to take them. Thanks for your attention. I wish that you are not in this stage. You are awake as those people. And if you have any question, please feel free to ask. Still, we have time. Thank you.